and that if people do have any symptoms of mental health problems, for example, like depression or bipolar or schizophrenia, then a person should try and get help. And I think that's one of the
Mm.
main things is trying to get help, because we know that if someone is going through a difficult time, I mean, the question was, how does someone get help? And there is a lot of help out there. Surprisingly, Patrick, there is help out
Wow.
there, but people are not willing to get help. So it's more to do with the fact that people are scared to talk about. I mean, I don't know about how it is in your community, but certainly in our communities, I know it's really difficult to talk about the mental health. It's difficult to talk about how you're feeling. So
Mm.
definitely there is an issue with mental health. So, but getting help is really important. When if you are suffering with a mental health problem, or someone that's got symptoms and signs of a mental illness, for example, someone with depression, someone with bipolar or schizophrenia, someone that's self-harming, or even medicating themselves with drugs and alcohol, then we need to think about getting help. And I think the first step is asking for help or signposting that person to help. You can contact your GP, your general practitioner, the nurse practitioner, and then we have specialist services like the psychiatric teams. So every town, for example, Bedford, where you are based, we
Mm-hmm.
have a mental health team, and we'd have a community mental health team and different other teams, specialist services, and we'd have services for children, for older adults, people with psychosis, people with learning disabilities, forensics, eating disorders, and then we'd have, other services, the inpatient services, and crisis teams, which will work 24/7. So if someone is experiencing a crisis where they're self harming, they're not able to cope, then we'd have the crisis team that can support them. And obviously, all the treatment that is available, we usually talk about treatment in holistic terms, Patrick. I don't know if you
Mm-hmm.
have an understanding, or do you want me to explain a bit more about what that means?
Yeah, please, if you can explain a bit more for me, I'll be
Yes.
very grateful.
Yes, yeah. So, I mean, holistic. So, holistic is we talk about medication or the biological treatments or interventions. I'll talk about each one separately. Psychology is the psychological interventions or therapy, and then the social aspects, which is the social interventions of therapy. So, biological means and medication is, as you know, for every condition that we have, we use a combination of these three therapies and alternative therapies. And this is what's recommended by the guidance that we follow. So, as doctors and psychiatrists, we follow the NICE guidance, which is the National Institute of Clinical Excellence. So, for example, if we
Mm.
take something like depression, we know that a combination of medication together with psychology or talking therapies like CBT, cognitive behavioral therapy, we know that these two combined together is has been found to be very effective. So for someone that's
Mm.
going through a low mood, they're depressed for more than 2 weeks, they can't concentrate, they're not motivated, they're having some negative dark thoughts, and they might be suicidal, this is one of the forms of treatment that we could provide them with. So it's a holistic approach. We look at medication, which are called antidepressants. So the medication, because it's called an antidepressant, it tries to increase the happy chemical in our brain. So serotonin is released when we exercise. So if you go to the gym or if you exercise regularly, you know that serotonin is a happy chemical that's released. And this is what happens with the medication. The medication tries to increase the level of serotonin, which is low in the brain when someone is depressed. So, a lot of the time, the cause, we were talking about the causes of mental health problems. It could be stresses, it could be genetic, it could be related to, like what I'm saying, a hormonal or chemical imbalance in the brain. So, there's different reasons why we'd have mental illness, and then it's about treating the specific cause. So, as I was saying, in depression, we use a combination of medication, we do psychology, CBT, I don't know if you've heard about it, but has been shown to be very effective. I, as a psychiatrist, we've learned about CBT, and I've also done CBT with patients, and it has helped, because what happens with CBT is they try to identify. So it's cognitive behavioral therapy. So it means cognitive is our thoughts, behavior is how we behave in relation to the thoughts that we're thinking, and the therapy means that you do one-to-one sessions with a trained therapist, regular sessions. It can be anything from 12 to 16 sessions for at least 50 minutes. And in those sessions, the person will learn to change the way they're thinking from a more negative to a more positive. And eventually, all those symptoms of depression, when they change their thinking from negative to positive, and they change the behaviors related to their thinking, then as a result of that, they will start having a more positive outlook on life. They'll start feeling a lot happier, and all the symptoms of depression slowly improved. So, cognitive behavioral therapy is something I can say, without a shadow of doubt, is very, very beneficial. So, especially for people, Patrick, not everyone wants to take medication, and we understand that. We have young children that are going through, stresses at school, or personal difficulties and challenges. We haven't even touched on the surface about how young people in the minority group feel about growing up, in the context of the challenges of race. We haven't even touched on that, because that in itself can also cause some mental health problems, especially if a young child becomes a target of being bullied because of their race. This in itself can then lend to a child becoming depressed, or having sleep disturbance, or start coping with substances, or might affect their school performance. So there could be so many different reasons, but in general terms, as I was saying, treatment is holistic. So it's medication, it's psychology, and it's looking at the social aspects. So the social aspects, we look at support groups. So for every type of illness, we've got different support groups, and there's different charity organizations. For example, Mind is a mental health charity, and that this charity, I can say I've heard really great things from people who've used them, people who've had mental illness. They also run support groups, they run different therapy groups. So in terms of support, we're looking at supporting the family, educating the families. If we educate families about the mental health problems, or friends and colleagues, then it makes it easier, isn't it? If someone knows what you're going through, wouldn't you agree, Patrick? Like, if someone knows, okay, so and so is suffering from depression, this is how we treat it, and this is how you can help them. So in terms of social support, it's looking at educating people, educating the person about their mental illness, about the triggers, how they can help themselves, looking at charity groups, charity organizations that can help. And for example, the other things is looking at 12-step programs. So if a person is going through substance misuse, if they're taking drugs, or if they depend on alcohol, we know we've got groups like the 12-step program for Alcoholics Anonymous, or Narcotics Anonymous. So, as I was saying, there's a lot of different treatments available. If anyone's interested, you can always have a look at the Royal College of Psychiatrists. They have a lot of user-friendly leaflets on the different type of mental illness, which I've mentioned, like depression, bipolar affective disorder, OCD, panic disorder, anxiety, grief. So it's www.rcpsych.ac.uk. But other organizations like Mind, Cruise is for bereavement. During the pandemic, we've seen a lot of people go through bereavement. So that's something that's obviously affected all communities. So it's not just restricted to the BAME, or the Afro-Caribbean communities, but it's obviously affected everyone. And that in itself has had, obviously, an impact on a person's mental health, as well as the COVID. We haven't even spoken about the impact of COVID, the effect it's had on people, the quarantine, being in isolation, to how it's affected people in terms of getting COVID and then having long COVID, and the
Wow.
possibility of PTSD, and people losing their jobs, losing loved ones because of COVID. So it's obviously affected all communities, but I would say I think the difficulty, as I said, going back to what I said, is because in our communities that we're talking about, and especially in the maybe in the BAME and the Afro Caribbean communities, we're not used to talking about our feelings. And especially, I don't know about being a male. It's something about being male, being macho. You know, I was walking past a sign today, the Samaritans, and it said, "It's okay not to be okay." And that's what we're trying
Yeah.
to promote. But unfortunately, society dictates and our communities dictate that it's taboo to talk about how you feel. How I mean, I don't know whether you'd feel comfortable just going up to your mate and saying, you know what, I'm not feeling well. It's very hard, isn't it?
Yeah, it is. It is. It is.
So
the segregation that comes with it.
yes.
You know.
So
Yes.
this is
At
what
the end of the
this is
day.
what yeah, this is what we're dealing with, and I mean, you being a male, I'm sure you can understand what I'm trying to say. It's very hard, even in your families to talk about it. Say if you go to your a relative and say, you know what, I'm going through a very very difficult time. How many of them will say, okay, tell me about it? They'll just say, you know what, you just get on with it. You just need to
You need to be a man.
exactly. So so what do you do then? I mean, if you're struggling.
Very true.
Yeah.
Very true.
So I think what it's about is, that's why it's so important that we spoke about this today, because it's about us normalizing mental health problems, making people aware that there is such a thing as mental health problems, that if so and so, if you can see, maybe Tom or Jess is starting to isolate themselves, or they're not going to school, or they they're starting to show signs that maybe they're drinking more, that, we need to start having these conversations, listening. So I think the key skills is talking and listening and asking for help.
Mm, yeah. Ladies and gentlemen, this is Pat McCracken UK. My name is Pat. We are talking about mental health, and we are having a conversation with Dr. Seshni, a consultant psychiatrist. She's opening my eyes to so many things. If you have any direct message or on WhatsApp, you can send it to 0741302556. If you have, I would ask the doctor for you. Dr. Chesney, going forward, I've come to realize something in the diaspora. Mental health illness as spiritual. And sometimes when we discover these things, we take it to religious houses for prayer to cast it out. How true is that? Is that ideology about mental health, ill health?
Well, that is so interesting that I personally do feel that spirituality. So there's two things here. One is I want to say that yes, in terms of some communities, belief, the cultural beliefs that it could be a spiritual manifestation, and that's why the person is not well, and obviously, go to churches or seek, like growing up in South Africa, they seek the help of the Sangoma, or in the Muslim, they seek the help of the Mulana. They might think the person's being different cultural, obviously, beliefs, so that's the one thing. And then the second thing is to talk about how spirituality can actually help when so which one do you want me to talk about first? The first one that we were discussing.
Yeah, I want us to talk about spiritual and the attack, solving it with spirituality. Then we'll come to how spirituality can help it.
Yeah, exactly. So I think what happens in a lot of beliefs around spirituality and how it can impact on a person's mental health. And so they obviously, some communities, they do believe that when someone is unwell. It could be that they're either possessed, as I said, or that it's some effect of a genie, or that they need to do some sort of exorcism, or they might need to do certain rituals or prayers by a mulana, a priest, or organizations obviously have different ways of dealing with it. And I think it's difficult because I think there's been a lot of research into this. And as I said, there's something called a sangoma where people will actually go to the sangoma and say, pay them so much of money and say, please help my relative or my children. And I think it's it's hard to say that because it's a belief and it's a cultural belief. It's hard to say that it doesn't exist. That is not a reason why the person is presenting. Obviously, for us as psychiatrists and doctors, we know that people obviously present with mental health problems. There's a reason why, whether it's a genetic component, whether it's related to a stressor, a social stressor or trigger, or whether it's related to, like a chemical imbalance, like the serotonin, and that's why the person is depressed. Obviously, for us as a medical professional, scientific basis for why the person is behaving in that way. But I must say that obviously there is the other to think that if people have these beliefs, we're dealing with
Yeah.
culture, we're dealing with religion, and we're dealing with people's lives as well. So we must understand. And I think if we have to support families in that, and I think that is what has come out. Even with the Royal College of Psychiatrists, they have a specific nuanced culture and the different cultural groups and how that impacts on to the multicultural faiths and how that impacts on their mental. So I don't know whether that's the answer that you wanted, but what I'm saying is it is there. It's evident that people believe in it, and we have to support dismiss it. We cannot dismiss it when someone says, "Oh, this person is possessed," or these are the beliefs that people have. But it's not about
Yeah.
reinforcing the beliefs. It's about supporting culture and supporting them in terms of that person's mental health problems. So I think it is important. And just to say, I do practice something called, and
Okay.
maybe one day if you want to get someone from that center to come and talk to you. But it's called the Art of True Light, and they basically world. It's in Japanese tradition. And basically, it's about radiating light and giving people light. And what they say is that it's about purifying. They don't talk specifically about mental health, but they talk about how we need to purify our souls with light. So, whether it's purifying with light or prayer or, purify it with light. And they say the more and more we purify our souls, the more and more we help people for spiritual purification. Looking at it. So, I mean, that's
Yeah.
called Sukyo Mahikari. If anyone's interested, they can have a look at the online resources or the website. But talking about spirituality, is that I actually, at work, I presented a case a week ago about how impacted on the well-being and recovery of a person. And it's so because of confidentiality, I cannot disclose the details of the case. But what I've noticed is that the more and more, when we use spirituality, so apart from the holistic approach and alternative approach to helping people recover, when we look at spirituality, and that's why I was so amazed that you brought it up. I didn't even expect you to talk about this, but isn't that amazing how you ask the more and more we bring a person's spirituality in it. When people are going through difficult times, they find it hard to cope with. And sometimes when they draw their support, and if they draw strength from, it can help. And there's a lot of studies that have been done by people where they've actually increased spirituality, and they've done, studies, where they've identified and they've seen how, the practice of supporting someone with their spirituality, whether it's they're Christian or Muslim or Hindu, Sikh, Buddhist, whatever, that, just supporting them with their spirituality, how that has actually impacted and helped them during their, recovery and well-being. So I think it's really important. It's something I personally strongly feel, um, about, and I do always try, even with my patients, to always have, especially if we know someone is maybe a Christian or they, a Buddhist or whatever spirit, faith they belong to. I think it's important that we support people. It's going to become more and more important, as we progress, with the COVID and the pandemic. We've realized how important spirituality is. The answer that you wanted, was there anything specific you wanted to know about spirituality and, specifically in the BAME communities or the ethnic Caribbean communities, spirituality forms a really important part. And I'm sure people that are listening will agree that, when they're going through these, that prayer helps. I've seen personally, prayer, miracles, going to the church, all of that just helps. I don't know what your thoughts are on that.
Yeah. Maureen, you said you've worked with mine before, and then you agree with saying that spirituality helps other parts, say our spiritual being, but our minds remains untreated. So you feel depressed, you speak to a therapist. Not that you don't believe that God won't comfort you, but how do you train your mind? So, friend says that you treat spirituality as spirituality, and when you feel depressed, you speak to a therapist.
Yeah.
That is what you're trying to say. Thank you. So, Nana, you are also asking that do you think mental health patients are treated less at hospital? Dr. Chesney, is there anything like, say, a mental ill health patient will visit a hospital and they will be treated by another person?
Well, I mean, I as a professional, I would say no. We treat all patients with the same respect, compassion, and would with any person. But I'm sure that people with mental health problems might feel more sensitive that they are not being treated in the same way. Difficulty and the situation that they might be in. It's probably the, if they're going to hospital and they're in a crisis situation, that's a stressful situation. And if you go and present yourself to A&E or present yourself to professionals, then you might feel, if you're not seen immediately, the person or their families or friends, whoever they're with, might feel quite sensitive that they are not getting the right treatment. But I think an answer to that is that no, differently. Any person that goes to A&E or hospitals or picks up the phone to a helpline number will be treated the same way as any other a mental health illness or mental disorder. You are not going to be discriminated against. So there is definitely no such thing. And I hope this is to actually present themselves if they are struggling, or to ask for help or call the helpline numbers, because that shouldn't prevent them from seeking. And I must say, I really, really, I feel so passionate about mental health. I feel so passionate about people going through difficulties and actually asking for help. The moment we can that and we can normalize mental health, we can reduce the stigma, we can make it okay, that it's okay not to be okay, then to break down those barriers and also the misunderstandings and misperceptions. And one of them we've just spoken about, because that shouldn't, Patrick, stop someone from going and getting help just because they think, oh, if
Yeah.
I'm going to go to the hospital, they're not going to even treat me right. I'm going to be treated like an outcast, or I'm so and so way. But that shouldn't be happening in today's day and age. We are really open-minded. We are health professionals. We've got nurses, really brilliant trained nurses. We've got social workers. We've got trained therapists, assistant therapists, physiotherapists, speech and language therapists, you name it. We've got so many different professionals that work in a team, healthcare systems, professionals, and all of us treat people with utmost respect because we know, when someone comes with a mental health problem, you need to treat with them. They're going through such a thing. You need is someone treating you different or ill treating you. So we would always, and I want to emphasize, we'd always treat someone with respect, and with, and not just them, but also their families or whoever they come with, their relatives.
Mm. Thank you very much, Doctor. My time is really going. I would ask you this question as we would bring our conversation to an end, and I think we would call you again so that we visit
Definitely.
these topics.
I do apologize if I was still sort of, just in the beginning. But yeah, no, I absolutely love talking about mental health. So important. And I mean, you doing this, talking about it. And, people that are listening and sending in some comments, and that's brilliant. I really liked the Mr. Mullin said, because, when you about spirituality is how people compartmentalize treatment and
Yeah.
sort of different special. I really love that, that you go to a therapist and you'll talk about your problem, and then you'll go to the church and then you'll offer prayers. But this combining all those treatments, it's combining all the different approaches in your life. Because one thing might work for one person, medication might work for one person, be the talking treatments, another person, it might be all of them, the medication, the talking treatments, and talking to someone at the church. So this is where we need to be more creative, we need to be open-minded, and we need to use a more integrative approach. So it's holistic, but it's in
Thank you. So, Dr. Chesney, um, what advice would you give to people with mental health? Like you, people thinking about the segregation, how people see them. What advice would you give to them?
yes. So I mean, that's a fantastic mental health week we had. World Mental Health Day on the 10th, and it's the World Health Organization, and they are promoting reducing the stigma, the social status. And we need to, like Oprah talks about it with Prince Harry. They were doing,
Mm.
Apple talks on regarding mental health, the stigma. It's about also normalizing it. So if someone has to approach someone about their problems, receiving and the person that's listening will be able to respond in a more helpful way. So I think this is what it's about. If someone is going through any difficult time, realize that they can go and ask for help. They need to choose someone who's a confidant, someone who they can trust. And
Mm.
if they don't have a family member, they can seek help from outside. So that's where us as professionals and people working in mental health come in. And also these charity organizations like mine cruise, AA, Narcotics Anonymous, all these different groups, ad addiction. So all these different groups, that's where we come in through a difficult time. If you're feeling sensitive, or you're feeling, some people might feel, they feel so embarrassed, or they might feel that's to speak to anyone in their family, but so they might contact outside help. And I think I would promote that. If you can't find it in your and you're feeling helpless, I would say contact someone outside. So whether it's your general practitioner, a nurse practitioner, someone from a mental health team, or the crisis, or one of these organizations, I think, ask for help. And I think people that are listening, that are on the receiving end of being able to, I think we all need to educate ourselves to become more aware. So, it might be someone that we've noticed at work, or someone at school, or area somewhere. We might notice, okay, so and so is not looking how they look like they're not taking care of themselves. They're coming to work late, they're canceling appointments, or they're avoiding social contact, or on social media they're doing certain things. Then these are things that we need to pick up, and we need to see that person and saying, are you okay? That's so it's okay not to be okay. We need to normalize it. We need to make it okay for people to be a to offer help as well. So I think those are the main things. So it's every little bit helps. So it's not just about thinking that that person, we shouldn't. I mean, we shouldn't, in the way things are. And I do feel strongly that it's not just professionals that are responsible for helping people. Large, everyone has a responsibility to help other people, to identify if someone is struggling. If someone is struggling, who's not, that's going through a difficult time? I think what the pandemic has taught us, Patrick, is that people are more compassionate. We've all had time to think and button and pause. And I think people have become a lot kinder, a lot compassionate, showing more understanding and compassion. So I think a person that's going through any difficulties needs to realize that if they are struggling, if they need help, that there is help out there, and they need to be the one that step. Or if they can't do it, someone around them needs to have that understanding and be able to say, okay, I think you're going through a difficult time, or let's look at some organizations or services that can help you. And I think, with the aim with this is, we know that people and health problems. So whether it's self-harming by just, self-infliction, by cutting themselves, by taking overdoses, by, using substances, just cocaine, or drinking, and becoming, dependent on alcohol, or whether they hang themselves. We know that people do end up killing themselves. And this is why this talk today is so important, is because it's for people to realize that it doesn't have to go that far. You don't have a point for you to get help. So,
True.
yeah, and that's
Thank
what,
you very much, Dr. Shes. Yeah.
yeah. So, and that's
Yeah,
where,
sorry, you're going to say.
for the closing point, is that I've treated so many people with mental health problems, and not just myself. All the health professionals around, the country and the world treat people with problems. And when someone's going through it, things can look very dark and gloomy. But when you're going through it, it's hard to see any light at the end of the tunnel. But I can a lot. We've had success rates with a lot of people, and that is why we treat people holistically with medication, psychology, social, and a range of alternative therapies. Because it's like Rome wasn't built in a day. It's all about taking those baby steps towards recovery and well-being. And eventually, people do, each person that hope that they will be able to recover. And people do get better. It's all a journey, it's all a process. It's about, they say happiness is a thing, it's a process, it's a journey. We all have to take time to heal. And when you go through difficult times, when you experience mental health problems, it's about, it's not cut yourself and you can just put a band-aid over it. And you know that you've cut yourself because you can see it. Or if you've broken your leg, if you've injured your, they've put a cast and 6 weeks time it's going to be healed. It's not like that. Mental health you cannot see with the naked eye. It's not visible with the naked eye. So it's, someone could be struggling, they could be really internally going through so much of turmoil and conflict and difficulties and crises, and then it's about to heal and helping them to recover, giving them that hope that things will get better. And eventually, tomorrow will be a better day. And this too will shine, after the clouds and the rain and the storms, that sun will shine and people will start to feel a lot better. And um, that tomorrow will be a better day. So yeah, I think that's a good note to end off on.
The sun will shine every day.
Yeah.
Thank you very much, Dr. Chesney. I am really, really grateful. Like, I know I'll give you a very short notice, but so grateful. Thank you very much.
Oh,
Thank
thank
you
you,
so
Patrick.
much.
It's been absolute pleasure. I absolutely loved it. And I hope I'm going to chat to you again, and your listeners are going to get
Sure,
to send them through whatever difficulties they are going through.
sure, we will. We will. Thank you very much, Doctor.
Thank you so much. Have a fantastic
Nice talking to
evening.
you.
Listening. Bye.